Welcome back here to Midday Kentucky. I'm joined now by Dr. Perry Williams, owner over at Winchester Chiropractic. And today we want to talk about a pretty common subject, and that is ankle sprains and how a chiropractor can help you. So thank you for coming in today.
Oh, thank you. It's good to be with you. And, you know, it's a very common thing. I appreciate being able to come on here every month and talk about different things. We're starting to run out of joints, per se. But we left out the ankle, and it's funny because it's one of the more common injuries. About 3 million a year. WebMD reports about 25,000 per day on ankle injuries.
Wow, so it's pretty common.
Yeah,
and you're saying there's also different types of ankle sprains,
yeah,
right?
Absolutely. So you can have inside sprains or outside sprains, and that's what the diagram you're looking at right there. It just talks about different places. Like we would say in that case, it's a little toe side, and that's commonly the lateral ankle sprain is what you're going to see. And differentiating that from other types, sometimes on the outside, there's basically low versus high, and then there's medial on the inside and lateral to the outside. And how you hurt these and an accurate diagnosis, and that's important with any type of injury. You just want to make sure first thing you do is have an accurate diagnosis, because depending on where this is hurt depends on our protocols, our ability to get you back on the field or the court faster if we have an accurate diagnosis of what you've got wrong. Yep.
And how can we tell if we need an x-ray? Do you just first need to come see a professional?
Not necessarily.
Okay.
I mean, as a general rule, there's some great guidelines that came down from Canada. We've been using them for years, but it basically says if you have pain on the lateral aspect of this, back here, pain on the inside, pain on certain joints, but the old standby, 3 weight-bearing steps. So if you can take 3 weight-bearing steps on your ankle as a general, even it can be a little sore or a little ginger, that's considered okay. And those are called the Ottawa guidelines, and we kind of follow those. So 3 weight-bearing steps. If you cannot bear 3 weight-bearing steps, probably need a picture.
And how long does it take to heal a sprain? Does it vary on the type of sprain you were talking about?
It absolutely does. High versus low, medial versus lateral, and what we call a syndesmotic sprain, which is classically called the high ankle sprain. And that's where the bottom 2 bones actually tend to separate just a little bit. That can be a more serious injury. In the NFL, they did I think a 12 or 13-year study. They found about 15.4 days lost from ankle sprains. And so it does depend on which type, the severity of how long we can get you back. But that's our job, is to try to enable you to do more, not disable you to do less. For example, we had a young man who practiced full practice yesterday. He was told 6 to 8 weeks. He's on week 4 in 3 days. So like that's what we try to do, is as the body allows, it's self-healing. We're working with a great organism in the human body and just trying to get you back as fast as possible.
What are most people doing when they sustain this type of injury?
Yeah, so a lot of times it has to do with other folks. So in other words, I'm on a football field or I'm on a basketball court, or I come down on top of someone's ankle and it causes me to roll it or twist it, like what you're seeing right here. Oftentimes, even, you know, stepping in a hole or an old fence post, it's like around the house. Just make sure you fill those things in. Don't leave big holes and craters laying around for other people to come and stick their ankle in, right? So that's really important in this field of play. Want to make sure that it's good and safe as well.
So if you do fall in one of those holes or sustain this type of injury, why is it beneficial to see a chiropractor?
Well, one of the things that we can do that I think makes it unique is that all of these different joints and all these different bones can be adjusted or manipulated. So in other words, if we know, for example, that it was this lateral type and the ankle rolled in this manner, then we know that we can come in here and then in just kind of almost in reverse traction and reset that joint. We can also take small instruments or small tools and kind of work on that as time allows and help adjust and just speed up that natural recovery process and hopefully, again, get you back out there a little bit quicker.
And are you accepting new patients now? If anyone has these symptoms at home, what should they do? What's the first step?
Absolutely, and of course. And so you can call our office. Also, primary care physicians work with these pretty fairly. We encourage folks to see sports folks. So sports injuries, see sports folks. We like that. Your athletic trainer, your physical therapist has a lot of training in these as well. And we're big on the big team approach. Absolutely.
All right. Well, Dr. Perry Williams, thank you so much for coming in today. We'll put all the information up on the screen. Head over to Winchester Chiropractic. They have a great Facebook page, also their website, and you can see the phone number there on your screen. Thanks again.
Thank you.
We'll be back with more Midday Kentucky after this break.